nursing, just the broad definition of skilled nursing?
So the broad definition of skilled nursing is a location that people can come, a lower level of care, that people can come and recover. I think that's probably the easiest.
What is the difference between skilled nursing and long-term?
So the difference between skilled nursing and long-term care is skilled nursing is a higher acuity. Long-term care, those are the folks that live here. They don't have anywhere else to be, so this is where they're going to live out the duration of their life.
From the continuum of care, how does skilled nursing differ?
Can you be a little bit more specific?
What kind of services do you offer, let's say, compared to a ER hospital or
a rehab facility? Like, what's different? Why would a patient come into skilled nursing?
Okay, so a patient would come to skilled nursing who requires continuation of nursing services, but maybe not the level of an acute care hospital. We still provide services such as IV antibiotics, wound care, trach care, diabetic teaching, rehab. The rehab that we would provide here at skilled nursing is slightly lower level than at a rehab hospital. Rehab hospital would anticipate the patient participating in therapies 3 to 4 hours a day, whereas here we would only anticipate 1 to 2 hours a day, maybe because of strength or an infection.
What kind of trends do you see with skilled nursing in the future?
So as far as trends for skilled nursing, we're seeing the shift of care going into the post-acute environment. So we want to get people out of the main hospitals or the acute care hospitals as quickly as possible, and we want to get them home as fast as possible. Here at skilled nursing, we provide as close to a home-like environment as that we can, and we are going to help them recover, whether it's with wound care, IV antibiotics, or therapy, to get them home as quickly as possible. Other trends that we are seeing is a younger population, whereas a lot of people think of skilled nursing and nursing homes as sort of a place for older folks. We're seeing that downward trend as far as the ages. So we're getting folks that are in their 30s and their 40s that are requiring long-term care.
And what kind of employees does skilled nursing hire?
What type of employees? That is a good question. We like people who are passionate about giving care. We like very positive people, energetic. It takes a lot. We do have higher patient ratios than at the acute care hospital, but similar types of patients, which doesn't quite make sense to some folks, I know. But our nurses and our CNAs as well are very positive, energetic. They're very much geared towards getting people home and providing education. We have RNs, LPNs who work side by side. We have CNAs and we also have restorative aides, and those restorative aides are CNAs who've been cross-trained in therapy, who can help get people up and moving and doing passive and active range of motion in the bed, so maybe they're not strong enough to get out of bed yet. We'll have the restorative aides getting in there and getting them stronger, and also help maintain as much functionality as possible. I'm trying to think what other stuff. I have some really awesome employees. So.
How many, what's the ratio of nurses to CNAs? Are there a lot more CNAs than nurses?
We have 1 nurse and 2 CNAs for each one of our hallways.
Okay.
So on the skilled side, the ratios are about 1 to 10 for the nurses and about 1 to 13 for our CNAs. We don't go over that because we don't believe that they can provide good care if they go over that.
Right.
And it's similar back in long-term care. In long-term care, it's 1 to a max of 23. And then for the nurses, and then a 1 to 13 for the CNAs.
Okay,
as well.
That's like nurse to patient ratio?
Yeah, that's the nurse to patient ratio.
Cool.
Yeah.
Is there any history for this facility, Renown, that you know of that's interesting or different from other facilities?
Well, this building has been here since the mid-1970s. It has always been a long-term care. We have progressed and kind of shifted over into the skilled environment, and we're seeing more and more skilled patients here. Higher acuity patients. The kind of patients that you're seeing now on our skilled side are probably what you would have seen on a med-surg unit 10 years ago. So we have some pretty high acuity patients. She's an old building, but we love her. I can't think of off the top of my head any interesting stories, but we're currently going through renovations, which I'll show you guys, and you can kind of see how we're trying to keep up with the times.
Cool.
Thank you.